Hi, it's Danielle, the Pelvic Health Physio. This is part 2 of our little video series giving some visuals to what we were trying to explain on our talk with the pause when the video feed was not working. So this was to follow up on some of our discussions around the anatomy of the clitoris, which we were talking about in reference to both sort of normal sexual function and then sexual issues around peri and postmenopause. So, I do want to quickly fact check something that I said during the talk. I said that Professor Helen O'Connell, an Australian doctor, mapped out the full anatomy of the clitoris in the 1990s. Turns out I was wrong. It was 2005. So we've actually only known the full extent of our own anatomy for 19 years now, which is a little bit devastating. But also kudos to Professor O'Connell because she's brilliant. So I just wanted to give a quick visual. So back to my trusty pelvic model, we were talking about the muscles here before. So if we look underneath the muscles, then we've got this blue area here and this little yellow area here, and all of that together makes up the full extent of the clitoris. So I think many of us, or most of us, would know about the glans clitoris and the clitoral hood that sit around the top of the vaginal opening, or the front, depending on how you're orientated. That then extends internally and is connected to these two bodies on either side here. So both of these are made up of erectile tissue, this more so. And what they do is pretty much the same thing as when someone with a penis gets an erection, is that we get this massive increase in blood flow to the area. They become engorged, and what then happens with arousal, with enough time for this to happen, is that it will splint open the lower part of the vaginal opening and will also help to lengthen the vaginal canal a little bit, ready for any kind of penetrative activity. I want to just give a second visual because I think this is really, really interesting. Just like I said, it is similar tissue. If we're then comparing the two, so this is color-coded by what's what. This tissue that makes up the whole underside of the erectile tissue of the penis is the same thing as what's sitting here around the vaginal opening. And then what makes up the foreskin and the head of the penis is the same thing as our glans clitoris and the clitoral hood. It's the same tissue orientated slightly differently, which I think is really, really fascinating. So yeah, hopefully that has been useful to know.